Hello and welcome to Dateline Lagos on Channels Television. I'm Ayo Tunde Balogun. Coming up on the program, HEFAMAA holds stakeholders meeting on combating quackery. Lagos State trains health workers on better service delivery, and World Bank, federal government rates Lagos high for appeals project. The Lagos State Health Facility Monitoring and Accreditation Agency, HEFAMAA, says it has shut 40 health facilities in the last 6 months over quackery and seeks stakeholders' collaboration to curb the menace. Take a look.
Medical experts and other stakeholders in the health sector in Lagos converge on Adeyemi Bera Hall, Alausa Ikeja, for the 2023 meeting on combating quackery in the health sector. The event, organized by the Lagos State Health Facilities Monitoring and Accreditation Agency, HEFAMAA, which has shut down 40 facilities in the last 6 months. This meeting will also deliberate on how to stop operations of unqualified health professionals in the sector.
And what is the impact that this quackery has on the society? It's a multifaceted hydra, which has a lot of impact on the society. It not only has an impact on the victim that goes to these practitioners for healthcare, it has an impact also on their friends, their families, and society at large. So, for instance, let's take the common ailment we have in Nigeria, which is malaria. And you go to a quack, and the quack has no idea about what malaria is and gives you something that will not address malaria at all. And you continue to have this unabated malaria. You lose time from work, you lose time from your well-being, your family members and friends become so concerned that you are not getting better. And that's just with the simple example of malaria. So when we think about other diseases that are as significant and prevalent, we don't want society to go to quacks for care. Please be advised, there's no such thing as somebody having 20% typhoid and 60% malaria. It does not exist. I have seen through being the chairman of HEFAMAA where these quacks will produce lab work that shows you have 20% malaria and 60% typhoid. You either have typhoid or you either have malaria, or you can have both. You don't have a percentage of malaria and you don't have a percentage of typhoid. So please be warned. Also, it is imperative that in Lagos State you are aware of the fact that when you seek health care from facilities in Lagos State, it must have the HEFAMAA logo. This is why and how HEFAMAA is trying to blight this scourge in Lagos State.
From feelers that we have gotten, it's imperative that we invite even more people because we need to expand our stakeholders. In articulating our stakeholders, we have largely left out the public, and another important sector that we also left out was the those who protect us. I mean, like the policemen and then our prosecutors. But we have realized that in trying to combat quackery or bring it to a barest minimum, we need to involve everybody. And that is why we have this expanded stakeholders meeting. The main purpose is for everyone to see clearly that quackery has really embedded into the society and for us to find a consensus in trying to eradicate it.
Rooting them out will be no easy task, but the former Chief Medical Director of the Lagos State University Teaching Hospital, Professor Akin Oshibogun, believes community collaboration is critical to checking quackery.
Quackery becomes more and more easily detectable as society moves towards the modern theories of disease and evidence-based practice. Herbs and concoctions for different ailments were discovered through trial and error. Folk medicine persists still today in many societies across the globe, including in the most developed countries. What is in doubt today is the usefulness of some of the medicines, such as snake oil, agbojedi, ọ̀pá-ẹ̀yìn, akape, and other types of cure-all medicines. The established regulator must maintain a reliable intelligence network. The established regulator must maintain a reliable intelligence network and must dominate its space. Its presence must be felt. The established regulator in Lagos State, of course, for facilities will be HEFAMAA. As I mentioned earlier, quackery thrives most in ungoverned health spaces. The Lagos State government and other states that have established agencies for health facility monitoring and accreditation must be commended in this regard.
A call echoed by law enforcement agencies.
Any member of the public who sees any illegal activities being perpetrated are enjoined to report such to the police. And then we, the police, we have the responsibility of notifying the regulatory bodies. And for us to have a joint task force that will visit the location where or how we can confirm the reports that have been given to us. I don't know whether you understood what I just said. We need to work together in the slogan of you see something, you say something. I would enjoy you also not to be scared, because in our communities we have some of these vices going on, and many just choose to keep quiet for fear of being molested or harassed or even killed. If we decide to keep quiet, the day it will happen to our families or relatives, then we pray we don't regret our actions. We don't want quackery. We say no to quackery.
We need to criminalize, and we have to make sure that we eradicate auxiliary nursing program in our community. All of us are culpable because many of them will come to private hospitals for training. Private hospital that is not accredited by either the council or the Ministry of Education, Ministry of Health. You see hospitals just dominate themselves to training institutions. All these areas we need to look at in order to curb quackery.
There's also need for close collaboration between players in the private and public sector.
You will all agree with me that this business is everybody's business. We are all going to combat quackery together, and it is doable, and we will achieve this in Lagos State health sector.
HEFAMAA puts the minds of Lagosians at rest with a reassurance that it's committed to delivering quality services to actualize the agency's regulatory mandate.
Still on healthcare services, this time the Lagos State government, through the Ministry of Health, has trained health workers under its 2023 Continued Medical Education Program to achieve improved service delivery for Lagosians.
On a daily basis, individuals, pregnant women, parents walk into various hospitals to get medical attention when down with an ailment. As part of efforts to ensure quality healthcare services in Lagos, the state government is training health workers on improved service delivery for patients.
The theme of this year, Continue Medical Education Program, is improving healthcare service delivery in the state. And you will agree with me that this is very, very important topic, theme, especially in times that we are in. The Continue Medical Education Program is one of the strategies of the state to attain the Pillar 2 of the Team Plus agenda of our able Mr. Governor, Governor Babajide Olushola Sanwo-Olu. And the reason why we are also doing this is to update our knowledge, to acquire more knowledge, to learn new things, to improve what we know already. And of course, this translates to improving healthcare service delivery in the states.
The exercise, which is part of the 2023 State Continuing Medical Education Program, is also to enlighten the medical workers on how to be resilient while at work.
Resilience does not mean not wanting to give up. Resilience doesn't even mean that you don't fall into depression. Resilience doesn't mean you don't complain or rant. It doesn't mean you don't get angry or frustrated. It doesn't mean that you don't wish things were different. All it means is that after that episode, you take your thoughts in hand, you look to the future, dust yourself up, and you get up again. Now, what are the things that characterize resilient people? Number one is they have a growth mindset. And all that means is that they see adversity as an opportunity to learn a lesson. Resilient people are flexible and adaptable to change. Resilient people are self-aware. They are able to come up with better stress coping strategies. I'll just mention one more. They do not focus on what they cannot control. And I know that sometimes the things we cannot control seem more than the things that we can. But the better we're able to control the things we can control, the better we are in the mental place that enables us to find solutions to the things that are outside our direct control.
The Permanent Secretary from the State Ministry of Health, Dr. Olusegun Ogboye, encourages the people to be mentally stable at all times, irrespective of the challenges out there, and also asks the public to practice clean hygiene at all times.
Beyond teaching them or building their capacity to provide good quality services, we're trying to build their capacity to also provide it while preserving their own health and their own mental strength. Living in Nigeria now is a very tough place, and it's hard for everyone. And it's important that someone also is caring for the carer, because most times we look at health workers as just people who care for other people, and we teach them, the newer forms of medicine and the work that they're actually supposed to do. But we've come to realize that doctors, nurses, other health workers are just as vulnerable as members of the public to a lot of other problems, mental health challenges, physical health challenges, and it's important that we also prepare them to pace their work and also to very quickly recognize these signs and seek help, as well as take things very easy. We have a very strong surveillance system that exists in the state. We have an EOC, an Emergency Operations Center, that has several little work groups, and we have a reporting system at the local government level. So anytime there's any of these diseases reported anywhere, the DSNO in that local government then escalates it to the epidemiologist at state level, and then we go back, we investigate, they take samples, they confirm, and then they start to trace contacts as well. So there's a very strong surveillance system that is recording incidents of any of these diseases around the state. General hygiene, wash your hands, as often as you can, cook your food thoroughly when you can, boil water that you're going to drink. If it's not like water that is really clean, if the source is questionable, boil it thoroughly. Just general hygiene in what you eat, what you put in your mouth, and what you put around your body.
This exercise will go a long way in reshaping the Lagos State medical workforce for better service delivery.
Lagosians, it is no news that the present administration of Mr. Governor Babajide Sanwo-Olu delivered projects in different sectors of the economy through the themes agenda. With this success in mind, the second term of the present administration has included social inclusion, gender equality, and the affairs of youths in its agenda. Now, we have the themes plus agenda. With this, no one is left behind on account of their social status, gender, or age. Lagosians, Be prepared for another 4 years of a total revamp in all sectors. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe ni o.
And finally, on the program, the World Bank and the federal government has commended the Lagos state government for its effective and efficient implementation of the Agro-Processing Productivity Enhancement and Livelihood Improvement Support Appeals Project in the state. Speaking during the World Bank and Federal Government Appeals Project 10th Implementation Support Mission Field visit to Badagry, the task team leader of the World Bank, Mr. Manivel Sene, and National Project Coordinator hailed the Sanwo-Olu administration in charge of Lagos Appeals Project for its commitment to farmers in the state.
Badagry emerged as a commercial center on the West African coast, which shares the border with the Republic of Benin. It's mostly dominated by farmers, a major reason why it's one of the areas benefiting from the Agro-Processing Productivity Enhancement and Livelihood Improvement Support Project in Lagos. The Appeals Project is a 6-year federal government initiative supported by the World Bank, and the team is here to see things for themselves, catch a glimpse of fish cage culture farming as well as harvesting.
Even at that, even the ones inside food, right? You can jump out. The food.
Both the federal and state governments are pleased with the success in the last 6 years.
This is part of our supervision mission. As you know, every 6 months we do what we call implementation support mission, going around the implementation states to assess the level of progress in terms of implementation of our different activities being implemented in these states. So it is really wonderful. We've seen it, not just reporting with pictures, but we are here, we've seen it live, and we're interacting with the farmers because a lot has been done, and it's one of the really success stories to tell, because it's a model very rare that you will see in any part of Nigeria, this kind of fish cage culture being practiced. So it is one of our greatest achievement as far as Appeals Project is concerned. And with Appeals Project, you can see the success of it being practiced here. And behind us, I think there is also a similar fish cage culture being done by the state, to tell you at least, based on the success stories, there is that room for more people coming out, because by the time people now see it under this kind of natural habitat, people will embrace it, because ordinarily it is under controlled or pond. You see people doing their, especially this tilapia kind of fish farming. But this under a natural habitat, which people will prefer, because the taste will also be the same. There is no difference from what you get within the lagoon and what is being farmed under this fish cage culture.
The cage culture is a technology that is already on shelf. You know, we're not reinventing the wheel. It's just that with Appeals Project, the adoption rate is higher because of the support of the government. You know, so today you can see quite a number of our clusters here. As we speak right now, we have over 6 clusters that have been supported by Appeals Project. And then the Lagos State government has also supported quite a number of women and youth with cages. You know, if you look at the other side of the water body, you will find a lot of the cages that 150. Yes, 150 cages by the Lagos State government, you know, to empower the women and the youth. So basically what we have just done is to create an enabling environment for people to come in and practice cage culture. And what we have done is to support clusters, not individuals. You know, so we have 6 clusters, and some of these clusters have over 300 beneficiaries. And so I'm sure that in the next couple of months, when you come back here, you will see that they have also replicated, added more cages to what they're doing. For catfish, you blast freeze and then you sell. I'm sure one of them will tell you that right now they have a demand from even outside Nigeria for frozen catfish. There is a demand right now that Lagos State cannot even meet as I speak. You know, and then we're not leaving it just at this. We have the aggregation center. We all know that if they harvest the tilapia, tilapia spoils very fast. So the travel time and all of that. So what we have done in Appeals Project is to build a cottage industry, where we have blast freezers, we have cold rooms. As soon as you harvest, you take them to the blast freezer, and in less than 2 hours is stone ice. Why do we want to buy imported fish when we can grow fish ourselves in Nigeria? So that's part of what our Appeals Project is doing.
This cottage fish processing center is supported by the Lagos State Appeals Project for their 4 clusters in Badagry to support their business. There are different sections in this building, with spaces like the processing room and the packaging room.
18 pieces made 10 kg, both mixture of big and small, not smallest but medium. You can see it's not of equal size, it's different sizes. Everything is 18 pieces, made 10 kg. Now we want to descale it.
It also has a cold room area to preserve the fish.
It's very important that we know that our farmers bring in their harvested products to this place, and then we preserve them in the cold room. As you can see, farm frozen tilapia, right from the farm, fresh from the farm, and then we preserve it here. Then the consumers come to buy it and pick it up.
After moving around the facility, the appeals team listened to the success stories of farmers.
This project came when we mostly needed it the most because post-COVID and some of the challenges that happened in the country affected our farmers so badly. And we had challenge with sales, we had challenge with high cost of inputs, and most people were giving up. So that was when appeals really came in, and it did a lot of magic and really brought farmers back. About 60% of the farmers in the state currently were brought back to the business by the appeals project. Now we have about let's say 40% increase in production from what we used to have, with so many innovations now. So many innovations, unlike what we used to have then. We used to have a challenge with post-harvest losses, with gluts and the rest. So, but with the appeals project, they brought in a lot of new innovations, especially in the area of value addition at the marketing end of the value chain. So now we can do so much with our fish products.
The cage culture is not just for one person. It cuts across all the women farmers, that is Ogunge women farmers. And we're more than 400 women. And at these 400 women, you know that each family has more than four people in the family. And you know, when you do that, you have actually empowered a lot of people in that family. So with the cage culture that we have done, we have actually trained about 10,000 pieces of tilapia fingerlings. That was for the past 6-7 months. And now we have harvested more than 3.5 tons of fish. These 3.5 tons of fish, we have made a profit of about 6.5 million as it stands now. We are still harvesting the last cage. And now, when it comes to mushroom, aside from that, we are still trying to rejoice, to give thanks that appeals have done this to us. They now gave us a mushroom center where we can grow mushroom. Mushroom is a beautiful vegetable that we can eat. Everybody is supposed to be eating mushroom. We are here for the project to be extended. And as the project is being extended, we also need to work ourselves on how to also get all this machinery so that we can be able to feed the nation.
We are rice farmers that have been existing. But before the intervention of our P project, we are nowhere. We are just practicing consuming activities on the farm. But when API came in, they let us know that rice is a business and it can be commercialized. They gave us a series of training on how to go forward, like environmental training. They gave us record keeping. They even teach us security and safety on our farms. Series of trainings were acquired from our P project. Also, all what we are being asked for was provided by our P project. Like thresher, they gave us thresher, fertilizer, chemicals, harvesters, transplanters, and so on. Even up to viable seed, satisfied seed. So with this, I think we are moving forward.
The team lead from the World Bank assures the farmers that the request will be looked into.
So for Appeals Lagos, I want also to congratulate them for what they did with farmers. But I'm very glad to see that you know exactly the business you are doing. You have control over it thanks to the support of Appeals. And from the World Bank, we received already a request from the government of Nigeria for scaling or extending Appeals. Okay? This request is under review. I don't have capacity to respond to it because it's not me, but I'm part of the process. It's a senior management to respond to it. So this request is under review, and I think, or I believe the World Bank will respond at the right time. I cannot anticipate what the response will be, but it will be a response. Okay? So this is what I can say to you about your request or your expectation for further support to scale up your sustained investment, okay?
Lagos is said to have surpassed some of the targets of the project, with over 12,000 farmers empowered across different clusters in the state.
That's the program for this week. As always, thank you so much for watching. I'm Ayotunde Balogun. Till next time, please stay safe. Bye for now.